Hey everyone, it's me, Miss Ruiz, and I'd like to thank you for joining me as we cover Chapter 12, Coding Respiratory Conditions. Let's get started. After completing this chapter, you should be able to discern the various underlying causes of respiratory disorders, report the different types of respiratory disorders, determine the correct way to report cases of pneumonia and influenza, analyze the details required to report chronic respiratory conditions, accurately code any involvement of tobacco in the patient's respiratory disorder, as well as identify the appropriate use of external causes codes when applicable to respiratory conditions. Key terms: chronic obstructive pulmonary disease, COPD, exacerbation, influenza, pneumonia, pneumothorax, respiratory disorder, status asthmaticus. 12.1 Underlying causes of respiratory disease. Congenital anomalies. The most common congenital respiratory disorder is pulmonary hypoplasia, which is where the lung does not form completely or forms improperly. To report this condition, first determine the documentation whether the pulmonary hypoplasia is a result of short gestation, also known as prematurity. If the gestation is short, it is reported with code P28.0, primary atelectasis of newborn pulmonary hypoplasia associated with short gestation. If it is not, it is reported with code Q33.6, congenital hypoplasia and dysplasia of lung. Genetic disorders. Alpha-1 antitrypsin deficiency, which is a genetic condition that often develops into emphysema, with the first signs and symptoms appearing in adulthood, usually between the ages of 20 and 50. Cystic fibrosis is a genetic condition that causes malfunction of the mucous glands and results in progressive damage to the lungs. A mutation of the BMPR2 gene causes pulmonary arterial hypertension. Primary pulmonary arterial hypertension is reported with code I27.0, while secondary pulmonary arterial hypertension is reported with code I27.21. Manifestations of another disease. Measles or adenovirus may cause obliterative bronchiolitis. J44.9 chronic obstructive pulmonary disease unspecified. Left-sided heart failure can cause pulmonary edema, which would be coded with J81.0, acute pulmonary edema, or J81.1, chronic pulmonary edema. Pleurisy is usually a complication of another condition, such as pneumonia, lupus erythematosus, pulmonary infarction, or trauma to the chest, as well as tuberculosis. Tuberculosis pleurisy, for example, is reported with combination code A15.6. Trauma. Traumatic pneumothorax S27.0XX- may result from a penetrating chest wound or can occur due to a medical misadventure during the insertion of a central venous line or during thoracic surgery. Blunt trauma to the chest or a penetrating wound can also cause hemothorax, which is blood instead of air, as in pneumothorax. It fills the pleural cavity, and the code for this would be J94.2, hemothorax. Environment. Some patients may suffer respiratory problems from air contaminants at work. Examples of this would be J60, coal workers' pneumoconiosis, J61, pneumoconiosis due to asbestos and other mineral fibers, Z57.31, occupational exposure to environmental tobacco smoke, Z57.39, occupational exposure to other air contaminants, Z77.110, contact with and suspected exposure to air pollution, and finally Z77.22, contact with and exposure to environmental tobacco smoke, can be acute or chronic. Example of some lung infection codes include bacterial pneumonia, J15 code, community-acquired pneumonia, nosocomial, which is originating in a hospital pneumonia, viral pneumonia, J12, opportunistic pneumonia affecting individuals with compromised immunities, bronchitis, J20, or influenza, J09 or a J10 code. Lifestyle behaviors. At the beginning of the chapter in ICD-10-CM, use additional code where applicable to identify exposure to environmental tobacco smoke, Z77.22, Exposure to tobacco smoke in the perinatal period, P96.81. History of tobacco use, Z87.891. Occupational exposure to environmental tobacco smoke, Z57.31. Tobacco dependence, F17. Tobacco use, Z72.0. This applies to all codes reported from this chapter. 12.2 Disorders of the respiratory system. Pleural disorders. Pleurisy is also known as pleuritis, which identifies the presence of inflammation in one or both of the pleural membranes. Example codes for this include A15.6 tuberculosis pleurisy, J10.1 influenza due to other identified influenza virus with other respiratory manifestations, R09.1 pleurisy, J90 pleural effusion not elsewhere classified, S27.63XA injury to the pleura, laceration of pleura, initial encounter. Pneumothorax and hemothorax. Pneumothorax is the presence of excess air or gas in the pleural space, typically caused by respiratory diseases such as COPD or tuberculosis, TB. J86.9 pyrothorax without fistula, also known as empyema, an infection within the pleural space. J93.81 chronic pneumothorax. Hemothorax is an accumulation of blood in the pleural cavity, most often caused by an injury to the thoracic cavity. Remember, the thoracic cavity is known as the chest. J94.2 hemothorax is an example for this code. Pulmonary embolism. The presence of a pulmonary embolism can create serious problems for the patient, including dyspnea, which is shortness of breath, pain, or hemoptysis, which is coughing up blood. A large clot or cluster of several clots can result in the patient's death. I26.02 saddle embolus of pulmonary artery with acute cor pulmonale. I27.82 chronic pulmonary embolism. Respiratory syncytial virus infections. Respiratory syncytial virus infections, also known as RSV, can cause serious problems for infants. B97.4 respiratory syncytial virus, RSV, as the cause of disease classified elsewhere. Note that these categories are provided for use as supplementary or additional codes to identify infectious agents in a disease classified elsewhere. Pulmonary fibrosis. Pulmonary fibrosis may be caused by another disease, such as tuberculosis, or develops as a result of debris inhaled from the environment, such as the dust that may be breathed in by sandblasters or coal miners during their work. Pulmonary fibrosis is also associated as a side effect of certain medications. Example code for this would be J84.10, pulmonary fibrosis unspecified. Respiratory failure identifies that a patient's lungs are not working efficiently. Hypoxemic respiratory failure when you're not getting enough oxygen. Hypercapnic respiratory failure is when there's too much carbon dioxide. Example codes for this are J96.0 acute respiratory failure, J96.1 chronic respiratory failure, and J96.2 acute and chronic respiratory failure. 12.3 Pneumonia and influenza. Pneumonia is an inflammation of the lungs. There's viral pneumonia, bacterial pneumonia, protozoan pneumonia, and aspiration pneumonia. Code examples include J12.0 adenoviral pneumonia and J15.0 pneumonia due to Klebsiella pneumoniae. Pneumonia as the manifestation of HIV. Pneumonia may be a manifestation of HIV infection. B20 human immunodeficiency virus, HIV disease. Code B20 should be listed first, followed by the appropriate pneumonia code. Ventilator-assisted pneumonia. The attending physician must specifically document the diagnosis of VAP before you can report it. Remember, you must code what is documented. J95.851 ventilator-associated pneumonia. Notice there is a use additional code note to identify the specific organism responsible for the infection. Influenza is the formal term for what is commonly known as the flu or the grippe. It is a highly contagious and serious illness. Example codes for this include J09.X, influenza due to identified novel influenza A viruses, avian influenza, bird influenza, or swine influenza. J10, influenza due to other identified influenza virus. And finally, J11, influenza due to unidentified influenza virus. 12.4, chronic respiratory disorders. Chronic obstructive pulmonary disease. Clinically, there are three types of COPD: chronic bronchitis, emphysema, and asthma. J44, other chronic obstructive pulmonary disease, includes asthma with chronic obstructive pulmonary disease, chronic asthmatic obstructive bronchitis, chronic bronchitis with airways obstruction, chronic bronchitis with emphysema. Exacerbation and status asthmaticus. Acute exacerbation is an increase in the severe nature of a patient's condition. Status asthmaticus is a life-threatening condition that is not responding to therapeutic procedures. If both diagnoses are included in the notes, status asthmaticus and acute exacerbation of asthma, use only one asthma code for status asthmaticus. Do not use two asthma codes. 12.5, reporting tobacco involvement. Use additional code notation. Use additional code where applicable to identify exposure to environmental tobacco smoke, Z77.22, exposure to tobacco smoke in the perinatal period, P96.81, history of tobacco use, Z87.891, occupational exposure to environmental tobacco smoke, Z57.31, tobacco dependence, F17, and tobacco use is Z72.0. Let's look at the differences between use, abuse, and dependence. Use: smokes tobacco on a regular basis, taken by his or her own initiative. Even though the substance is known to be a detriment to one's health, there are no obvious clinical manifestations. Abuse: habitual smoking of tobacco, taken by his or her own initiative, even though the substance is known to be a detriment to one's health. Clinical manifestations are evident as signs and symptoms develop. Daily fixation on obtaining and smoking tobacco, with virtually everything else in life becoming secondary. Dependence: compulsive, continuous smoking of tobacco that has resulted in significant clinical manifestations, as well as the physiopsychological need for the substance to function normally. Any interruption results in signs and symptoms of withdrawal occurring within a continuous 12-month time frame. 12.6, respiratory conditions requiring external cause codes. External cause codes. In addition to reporting other codes, you will also need to report codes that explain cause of injury, such as a car accident or a fall off a ladder, place of occurrence, such as the park or the kitchen, and the activity during the occurrence, such as playing basketball or gardening. Patient status, such as paid employment, on-duty military, or a leisure activity. Chapter summary. Sadly, most people take breathing for granted until they cannot do it without difficulty or pain. You have to know how to code respiratory conditions accurately, whether you are working for a family physician, a pediatrician, a respiratory therapist, or a pulmonologist. In addition, respiratory conditions might be present in a patient of an immunologist, allergist, or ear, nose, and throat ENT specialist. Thank you everyone for joining me. That's all I have for you today, and I look forward to seeing you in the next video.